wean the patient according to, with the help of the physiological regulation of the patient. Then guiding surgical care. In the field of surgical care, planning and post-operative care are the most mature applications for machine learning enabled CDS tools. Other applications include real-time in the CDS for surgery, and AI-enabled surgical robots are also active areas of research. Outcome of cost of robotic surgeries in prostate cancer and multi-institutional studies in Korea. We know that this is going to be a very expensive treatment to the patients, but then as the results are very good and the patients, what we say, accept this, the many studies are done on this also. A comparison of total laparoscopic hysterectomy to robotic assisted hysterectomy surgical outcomes in the community practice. See, to compare gynecological practice and pre-operative outcomes of the patients undergoing total laparoscopic hysterectomy and robotic hysterectomy before and after implementation of robotic programs. Reduced operative time reduces blood loss, shortens length of stay, is achieved in patients who are treated robotically versus non-robotic approach. So we can see how it helps, and this is community-based, where we can implement this at the community level. Monitoring the patients, this is also discussed. Then FDA has granted emergency use authorization to software that aims to predict whether the COVID-19 patients will develop dangerously low blood pressure or respiratory failure. This study was done during this COVID time. Improving medication adherence, this is also discussed, how we can improve the adherence in medication with the help of the chatbots, smart pills, wristband sensors, gamification apps, and smart packaging. Few examples of such products include Fellow Smart, Pillbox, Clever Lab are the fits on the standard pillboxes. This is also one of the study. The FDA approves pill with sensor that digitally tracks if the patient has ingested their medication. So even we can track the patient if he has taken his medicine or not. That also can be tracked with the help of pillbox. Conversational interference to improve medication adherence towards AI support in the patient's treatment. Recording digital clinical notes can be done with the help of AI. Automating laborious tasks. Again, robotics already has been discussed. Then AI in health setting outside the clinic and the hospitals. Telehealth visits target high-risk population for more intensive healthcare interventions. Telehealth and remote monitoring outside the hospital and the clinics is followed. Telehealth and AI. Again, here there is a study on coronavirus self-checker in the interactive clinical assessment tool that will assist individuals from the age 13 and older. One study is there. Remote technology monitoring for promoting cardiac health. Then the efforts in the public and environmental health, we see Arogya Setu app. We all used this Arogya Setu app during COVID, and we were knowing who has taken the vaccine, who has not taken the vaccine, what was your dose, first, second, third, everything with this Arogya Setu app was helping us during that time. Then artificial intelligence applications for COVID-19 pandemic. Limitations is cost incurred in development, maintenance, and repair, lack of human touch, lack of human creativity, lack of common sense, abilities of human may diminish, robot superseding humans, human may become dependent on machine, wrong hands cause distractions. So these are the limitations of AI. Conclusion, artificial intelligence in healthcare is overreaching term used to describe the use of machine learning, algorithm, and software, or artificial intelligence to mimic human cognition in the analysis, presentation, and comprehension to complex medical and healthcare data. Human beings can create wonders through AI, but you can't replace human being. This is what we have to know. And I think no one can replace a nurse. That is there. Artificial intelligence can be followed, but the touch that is given by nurse, it won't be given by your artificial intelligence. That is what we have to follow. Take home messages. Let us unite together in this digitalized world and utilize AI, a step forward, better patient care everywhere, be it at home or hospital. That is what we have to follow and know about artificial intelligence. But it takes time. It is going to take time to bring it into the community sector because people are not at all aware. If we go in the community, they are not aware, and it's going to be a challenging job for us to take it to the public sector and in the community. Thank you very much for giving me this opportunity.
Thank you, dear Madam Sangeeta, for sharing the applications, scenarios, and n number of the studies. You really have the numerous studies to